I'm Michael White, Distinguished Professor and Chair of Pharmacy Practice at the University of Connecticut School of Pharmacy. Yes, I kind of fell in the back door into looking at Kratom. We've done a lot of work in our group, the Health Outcomes Policy and Evidence Synthesis group, looking at natural products. We also were doing some work in the area of illicit substances, and so here we're looking at substances of abuse and trying to get an idea about what the different pharmacologic mechanisms were behind the scenes that were causing some of the adverse events. So we would take that information, put it into easier to use guides for clinicians so that when somebody came into the emergency department or somebody called for a poison control center call, they would have some idea based on the symptoms that the people were reporting or the signs that they were reporting. So we had heard that there was a kerfuffle with Kratom, and that the Drug Enforcement Administration was looking to make it a Schedule I product. And so we decided to do a review of the evidence and see what the issue was. In general, when the DEA decides to make some of these decisions, there's not a lot of blowback. There's, it just kind of happens. But here, there seemed like there was a lot that was going on behind the scenes. And was that evidence-based? Was that not evidence-based? What did the availability of the evidence suggest at that time? And so, we wrote that review and we put it out. It was very well regarded in the scientific community. A lot of clinicians who hadn't heard about Kratom were very interested to, get some idea about what the current state of the literature was, what they could do if they had patients that were using Kratom, both to monitor for adverse effects, but also, if somebody was harmed, what kind of therapies that, they may want to use to try to treat them, and then to get a better understanding of why people were using Kratom in the first place. When the Global Kratom Coalition came and asked if I would chair their advisory committee, I was very skeptical. I didn't really know a lot about them, what their overall motivations were. Were they simply a trade organization and trying to protect patient health? But, as I found a little more about the organization and more about what it is that they wanted me to do, I felt a lot more comfortable. They told me specifically that one of the reasons that they wanted me to accept the role was specifically because with the things that I had already written, with the things that I had already put out, with the discussions that we've already had with people in the Kratom community, I think we're at an inflection point with Kratom. And I think that, things could go one of two different ways. And in either way, there's going to be significant risks for a portion of the population. So we really need to have the opportunity to try to thread the needle, that instead of going all one way or all the other, which may seem like a simpler approach in order to be able to implement, to do something that may be a little more difficult to implement, but would be the best overall thing for public health. At the end of the day, we're not going to be a body that's going to make any of those regulations, that's going to be doing any level of enforcement. But there may be benefit in the overall discussion to having an independent group of people who have no stake in whether Kratom sales go up by 100% or they stay the same or they go down by 5%. To look at these things and just try to say, what is the right balance that we have between access and safety for the population? When all is said and done, a lot of things are said, but virtually nothing is done, right? Hopefully that's not going to be what the advisory committee is going to be. I think that there's a lot of things that need to be said in order to lay the groundwork for the things that can be done. Hopefully those things will end up getting done in part or in whole, and that it can have impact at multiple different layers of society and help to provide the benefit to people who need it the most, and to try to minimize the risk for the total population.